Hello viewers, myself Dr. Chirag Chovatia. I am a consulting physician. Today we will talk about angina or angina pectoris. Uh, Firstly, let me explain what is angina or angina pectoris or chest pain. Angina is chest pain occurring due to reduction in blood flow and oxygen to the heart. What are the causes of angina? Well, the commonest cause is a narrowed or blocked artery that is supplying to the heart. Sometimes there is a formation of a blood clot. This can also be a cause. And some less common causes are stiffness of the artery, or sometimes there is reduced pumping by the heart reduction and hence consequent reduction in the blood flow or the oxygenation of the heart. So summarizing again, the common causes are reduced blood supply or oxygen to the heart are the narrowed or the blocked arteries or occasionally a clot formation. This is how angina occurs. So what are the signs, symptoms of angina, and will what will the various people, will they have the same symptom or there'll be some differing symptoms? So let's now discuss all that. So the commonest sign or the symptom of angina is a chest pain, which is the central in location at the center of the chest, typically here somewhere, and the patient complains of constricting type or heaviness type or crushing type. Typically a patient may say that he, as if there is a 20 kg stone laying on his heart, that kind of pressure is felt. And the other sites where this angina can occur is it can radiate to the upper back, or sometimes the left shoulder, left arm, or even the left forearm, and very rarely to the jaw or inside the throat. These are some common sites where angina symptoms occur. Having said that, so many times we have noted in our practice that epigastric stomach pain or acidity or flatulence or sometimes dyspepsia type symptoms also when the patient experience, sometimes the next day patient find out that these were the symptoms of heart attack. So one should take these symptoms also rather seriously. Okay. Apart from the chest pain and the various sites I've described, there can be some associated symptoms, or these may be other symptoms of angina, like uh, feeling of uneasiness, feeling of easy fatigability, that is getting tired, or sometimes weakness, or even fainting. So, well, what are the treatment options of angina? Well, first and foremost, whenever you feel that you are having a chest pain or chest pain like symptoms or some of the other things that we described, the first and important thing to do is to visit your doctor. When your doctor, he will do a physical exam, prescribe necessary test, and thereafter, if you are found to have angina or heart related problem, appropriate medications can be prescribed, and that's how angina can be treated. If sometimes the test suggests that there may be a major block, some further investigations may be required, and accordingly the treatment can be suggested further. Can angina pectoris be prevented? Well, angina pectoris can be prevented by taking care of your heart. Some of the things that one can do for as a prevention are: first and foremost, one needs to quit smoking, if or tobacco chewing if applicable, because this can reduce the disease in the heart arteries and consequently prevent angina. Next and most important thing is regular walking, exercise, or maintaining a good circadian rhythm, that is timely waking up, timely sleeping, and maintaining your meal times. These are very important for overall stress reduction in the body. Apart from this, a good diet, that is avoiding or keeping the junk to a minimal and having a balanced diet, is also goes a long way in preventing heart disease or angina. And most importantly, medically, for those patients who are having diabetes, blood pressure, and cholesterol, having a good control of these diseases prevents or at least retards the disease process that leads to angina. So, people with these ailments should get a good control and should have a regular follow-up with the doctor. And for those who are not known to have these diseases, they should get a regular medical checkup to establish that they have not now been diagnosed with such diseases. Normally, a 1 to 2 year frequency is good after the age of 40, when one should get a regular, thorough medical checkup to establish early such symptoms or to do so that what is needful. Well, to sum it up, ignoring chest pain or angina pectoris, whatever you call it, can be a really fatal mistake because it could be a harbinger or a pre-occurrence of a serious heart attack. Hence, one should not never ignore the chest pain or such kind of symptoms, as it could be something major. So what we need to do is, we need, as soon as any such symptoms are there, you must contact your doctor and do the needful. Timely prevention is very important, more important than any other disease in the body or related to the body. The timely prevention in the heart is probably the most important. And if you do, there's timely action is being taken, then any major complications can be avoided. Thank you, listeners. It was great to speak regarding this topic. Thank you for the opportunity. Thank you very much.